Smile makeovers, porcelain veneers. You do a lot of this in your practice.
Absolutely, because everyone wants to look good, healthy, and younger. It is the most, I guess, rewarding cosmetic procedure you can have, an instant improvement.
You say, well, I say, you look at least 15 years younger than your age. You've been practicing dentistry for 15 years. And you say it's because of your teeth.
Right.
Teeth can make you look younger?
Absolutely. I can take my patient that came in last week with the worst set of teeth ever, broken, gray, cracked. If you put them in my mouth, you would not say that I looked young. You would, you know.
Those same teeth in your mouth.
Right,
okay.
Yeah. If you put them in my mouth, we wouldn't be sitting here talking. I probably would feel self-conscious. I wouldn't be up here even telling people to fix their teeth. I'd be fixing my own teeth. But yeah, you wouldn't look young. You wouldn't look vibrant. You wouldn't look full of life. So that's what changing teeth does. And people don't realize it too, but I know like even sometimes my husband, like we'll be checking out in the grocery store and he's like looking like, what's wrong? It's not that anything's wrong with their teeth. They're malpositioned. They're mal-shaped. They took medications that made them discolor. It's not like that one tooth, you know, like he's staring at like, what happened to it? It's because of something that happened and it's fixable. It's minor.
So if you don't like your teeth, you say do something about it.
Right, and it can be some people think, oh my gosh, I'm gonna need a whole mouth of veneers and crowns and they're gonna have to drill all my teeth down to give me teeth that look good. It is not that, it's not that involved. It's very simple. You can replace a few crowns you have, you can put veneers in, you can just use ceramic and composite filling material to get rid of the areas that are broken, and you can shape the teeth to make them look feminine. I tell a lot of, again, this day and age where everyone's stressed and they've worn them down, people have worn down these square, old looking teeth. Bring them back, make them round, make them full, pick a shade, a few shades lighter.
You say, for some people, when you change their smile, their life changes. Is that true?
Absolutely. Yeah, we've had, you know, one guy who came and he would talk like this. He would actually like almost sign language to us just because he had this tooth, just that tooth was broken.
Okay.
Just one tooth was causing him to sign. He wouldn't talk to people. We did replace that with an implant, and that tooth looks gorgeous, and we fixed all the fillings on the other teeth. You know, it looked like he had gray and brown dirt in between every tooth. Once he got that done, he's out there. He's telling me about the friends he made at the librarian. He's telling me at the auto body shop. You know, like all of a sudden, he's at church. He's singing in the choir. You know, he's like all of a sudden he knows everyone. He's like, oh, I heard so and so. I don't know what he was doing before that. He wasn't getting out. Now all of a sudden he's the socialite of the community. So yeah, it's
all because of his teeth.
All because before he didn't want to talk to people. He didn't want people to see like smile, and they're like, whoa, goodness, big black hole. You know, and what's up with everything else in between? So it just changed his life so that he could be. He was always social. He just was not able to be social because of those
Do you
minor
believe
things.
that it's inevitable, if you want to look your best, that veneers are inevitable? That means if you always want to look your best in your 60s, 70s, because no matter how well you take care of your teeth, they're going to get a little dingy.
Exactly.
I said that, but do you believe that? That's part
I believe it so much. I'm pretty much have my appointment booked in about 30 years to get my veneers. I'm planning on getting them when I'm around 70.
Wow.
Because I don't want to look, I know I don't want to look 70. Call me vain. But I know at 70, I'm not going to feel 70, so I don't want to look that way, and I don't want the way I look to affect the way I feel. I know that, well, maybe my kids will have grandkids, but I know I'm still going to want to be out enjoying food and exercising and social engagements, and I don't want to look at that age. Now,
they'll say that about you behind your back. They'll say, she can't be old. Look at those
right,
teeth.
Look at those teeth. So I do think I don't say it's inevitable. There are a few people that have really, really white enamel. And again, coming into our office with our natural cleaning products, we can keep them as lustrous and as white as long as possible. But you just can't go through decades and decades and decades of green tea and coffee and stress and not think your teeth aren't going to start to look older. They will, and like I said, I know.
And you're going to do it in a holistic way.
Right, we're going to do all porcelain materials, no metal, no graying at the gum line, the most natural adhesives that there are that actually promote regeneration of tooth structure. And yeah, they're going to look, I tell people, don't, make them a little transparent. Don't just go for paper white. People sometimes want that, but I try to help people make them a little transparent, make them a little see-through, make a little different shading at the gum line. But yeah, because you don't want people to be like, oh my goodness, look what they went from dingy teeth to bright white pieces of chiclets in their mouth, but you want to be able to smile naturally and feel the way people are feeling better longer these days. So you still want to feel young and vibrant. And like I said, I know, sign me up. I'm going to be there.